So why the big focus on fetal cardiac screening? Well, congenital heart disease is the most prevalent congenital abnormality in the human fetus. The majority of these babies with congenital heart disease don't have any known risk factors at all. In fact, the highest incidence of congenital heart disease, around 50% in pregnancies, they're referred because of an abnormal finding on an OB ultrasound. And the incidence of congenital heart disease is approximately 8 to 9 out of 1,000 live births. So when we talk about the fetal cardiac screening exam, detection rates, I would challenge you guys, what do you all think the detection rates are in the second semester for congenital heart disease? Well, we know that prenatal detection rates for isolated congenital heart defects is less than 50%. And in fact, the detection rate for congenital heart disease in the second trimester is 15 to 57%. So something that's really kind of critical to keep in the back of your minds, you all scan patients routinely for extracardiac malformations. Something important to think about is anytime you have an extracardiac malformation, there's really a high incidence of related congenital heart defects, from central nervous defects to vascular to GI. Anytime there's an extracardiac malformation, really be thinking about associated cardiac defects. And the same can be said for chromosomal abnormalities. There is an extremely high incidence of congenital heart disease related with abnormal chromosomes. Some of the ones we're most aware of, trisomy 21, we see that probably a lot. The microdeletions. As you guys can see, many of these chromosomal abnormalities carry a significant risk for associated cardiac defects. So anytime you're scanning patients with chromosomal abnormalities, extracardiac malformations, really be keying yourself in, be thinking about the heart. So what's the role of the sonographer in all this? And I would say the sonographer, you guys out in the field, this is where it all starts. Ultrasound is the most operator dependent of any medical imaging modality out there. It truly, truly is. Everything depends on the images that you acquire. And in fact, when we talk about this 15 to 57% detection rate of congenital heart disease in that second trimester, it speaks directly to the operator dependency of this modality. Experience levels, education levels, that all plays a part in this. Why do we have this wide dispersion in detection rates? So what are we going to do? We're targeting our education and training of sonographers, and that's why I'm so pleased. We're all so happy that you're all here today showing this interest, because this is where it starts. And so if we continue these efforts towards improving our detection rates, we are going to have better outcomes. There's plenty of data and evidence out there that shows a direct correlation between that. So you guys are artists. So we know this is operator dependent. Your images are key. So you've got to have the right equipment, right? You need to make sure that you have the appropriate probes. You need to make sure your machine is set up to optimize cardiac imaging. Your presets should be using high frame rates, minimize some temporal smoothing. Just make sure that the tool you're using to acquire these images is going to put you in a position for success. Really important. Clips. You know, that's the beauty of working with the multidisciplinary teams. We all do things differently. From some people rely on static pictures. Some of us, you know, rely on cine sweeps. But I will tell you that to really delineate cardiac anatomy, normal or abnormal, it's crucial to incorporate some 3 to 5 second cine loops to really capture and see that anatomy. You know, we're looking at a three-dimensional object. And so, again, if you use cine sweeps, it's going to increase your odds of detecting abnormalities. So when we talk about this comprehensive cardiac screening exam, obviously today, 4-chamber view. That's what we're going to focus on. as well as the associated the outflow tract views and the 3-vessel view. But just bear in mind that while that's the focus of what we're going to be discussing today, a comprehensive cardiac screening exam is comprised of many more components, including the long axis views of the right and left ventricular outflow tracts, short axis sweeps from the base of the ventricles all the way up to the caval long axis views, imaging of the ductal and aortic arch views. Those are all really required to perform a comprehensive cardiac screening exam.